Hi, I'm Bob Mandel, founder of the Stroke Recovery Foundation, and today we're privileged to have Dr. Aileen Stoller. And Aileen is the Stroke Center Coordinator at Physicians Regional in Naples, Florida. And by way of education, Aileen is educated at University of Pennsylvania, at the University of Phoenix, and the University of South Florida. And she is a doctor in nursing, and she's been nice enough to join us on our podcast program to talk about a couple of things. But the first is to talk about the risk factors for stroke. And when you have a stroke once, there's a substantial risk of a second stroke. And so this is important both from the perspective of first strokes and future strokes. So Aileen, perhaps you can start talking about some of the risk factors in stroke.
Absolutely. Thank you, Bob. One of the things that people most often ask about is what can I do to change my risk of having a stroke? And as Bob said, if you've had a stroke, you stand about a 35% chance of having a second stroke, or even more than that, if you do not change your lifestyle and change the risk factors. So you can't really do that without knowing what the risk factors are. Unfortunately, there are some risk factors that you can't change. The three risk factors that are not modifiable are your age, your gender, and your family history. I'm sorry, you can lie about your age, but it will not change your risk of having a stroke.
And we all do that.
Gender also will not change your risk because a lot of it has to do with hormonal factors that predate adolescence and adulthood. So Caitlyn Jenner has the same risk of having a stroke as Bruce Jenner did. That is not modifiable. The other thing is your family history. If you're very good and very careful, you pick the right family, you might be all right. But if you come from a family that has a lot of heart disease, a lot of vascular disease, a lot of high cholesterol and lots of problems, then you have an increased risk. So unfortunately, you can't do anything about that, but you can be aware of the fact that it is a mitigating factor in having a stroke. If you come from a family that has a high incidence of heart disease or cholesterol and other lipids, then you know you need to be more careful with that. Women have a higher incidence of stroke later on in life after they go through the change of life because they lose the protective effect of estrogen. So you need to recognize the fact that you might need to do things differently as you get older because your risk changes. However, we do want to also talk about risk factors that can be changed. The first one I'm going to mention is high blood pressure, because it's not only responsible for the most common type of stroke where there's a clot, but it also puts you at high risk for the hemorrhagic strokes where a blood vessel can't tolerate the pressure and it bursts apart. So hypertension and uncontrolled hypertension is a real serious risk factor for stroke. And one of the biggest problems is that hypertension or high blood pressure doesn't really have any symptoms. You don't say, oh, I feel so bad today, I have a terrible headache, and I have this and I have that, my blood pressure must be high. Very often you have no idea that you're running high blood pressure until somebody takes it or until you have a symptom of a stroke that lets you know that you've had high blood pressure.
So doesn't that suggest that people should have regular physical exams where their blood pressure is taken?
Absolutely. And you can do that on your own. You can keep a track of it. You go into the drugstore and they have the free machines that allow you to do that, or you can buy one. You have to remember that your blood pressure is going to change over the course of the day.
Sure.
So when you do that, you want to make sure you always take it approximately the same time. When you get up in the morning, before you go to bed at night, don't get off the phone after having had a fight with one of your kids and decide to go take your blood pressure at that point in time, because that's not going to be representative of what it runs normally. So you do need to have regular follow-up. That's why it's recommended for people of Medicare age that they have an annual exam, because that is something that we can treat if we make the appropriate diagnosis, if we know about it. Now, the other thing is, unfortunately, there are some side effects that go with blood pressure medications. And because people don't have symptoms of high blood pressure, they're taking a medicine that doesn't make them feel any differently, unless they develop a side effect, and then they really hate the
Right.
medicine.
Right.
So people they get tired because their blood pressure is not high enough. They may get dizzy when they stand up suddenly. Men often report that they have difficulty with sexual performance because of the change in blood flow to different parts of the body. There are hundreds of different kinds of blood pressure medications in all varying doses. So that can be altered. We can switch to another one, we can change the dose, we can change the time you take it. And it's so important to have that conversation with your healthcare provider, because we don't know that you're having a problem with it unless you tell us. And if you just decide, well, I don't like this problem, I'm not going to take this medicine, and they're all going to do that and stop taking it, then you're putting yourself at great risk when it can be managed. So you need to be very clear with your healthcare provider and let them know that these risks, these side effects are not tolerable. You don't want them, and you can work with them to find another medication. Along with high blood pressure, another thing that very often coexists with that is high fats, triglycerides, cholesterol, these kinds of things. And this is a problem for stroke because not only does the fat sort of layer on the inside of the blood vessel and actually narrow the blood vessel, making it much easier for a clot to form because it now has to squeeze through a smaller space, but it also, over a period of time, invades the wall of the blood vessel. And then the blood vessel, the artery that's going to that area of the brain, is now thickened. So not only does it increase or decrease the diameter of the blood vessel, but it also makes the walls thicker and less likely to be able to contract and dilate and move around, move normally.
And you know, it's like when you have a very thick shake that you get at McDonald's, trying to suck that milkshake through, and you have trouble. Well, it's exactly the same in the body.
Exactly. That's a perfect example. Steak and shake milkshakes from McDonald's
Right.
that are real thick.
Right.
You can suck them, and it's just not going to go through that straw. So that's a great example. So imagine that your blood vessels are getting smaller and smaller and smaller diameter, and your blood is having to go through there. Well, eventually you're going to reach some turbulence. The blood's going to be swirling around in an area while it's waiting to be able to pass, and that's a time when little clots form. So remember that not only is it important to keep your blood pressure under control, but you need to be really careful about your cholesterol and triglycerides. What most people don't realize is that cholesterol comes from animal fats. So vegetable oil, olive oil, avocado oil is much preferable to lard and other kinds of animal fats. That doesn't mean you can't ever have an animal
Butter,
fat.
too.
But yeah, good point. Although honestly, I don't know how much butter the average person puts on their toast, because they're now starting to say that sometimes butter in moderation may be better for you than the margarine.
But when I see recipes and they take a whole
stick of butter
and throw it in,
Yeah.
I think we've got a couple of heart attacks going into that
Exactly.
pot.
You may as well, whatever that recipe is, you just may as well put it in IV and shove it right into your veins.
Shoot it through.
Yeah. So these are things. So remember that cholesterol comes from animal fats. That's why we say red meat is bad, because red meat has the highest amount of cholesterol. The pink meats like pork are less, chicken is less, fish is less. Granted, unfortunately, lobster and crab and shrimp have a higher amount of cholesterol than plain fish.
Particularly when you dip that lobster into butter.
Into the
just
butter.
like I do. But one of the few times I do that kind of stuff, but I do it.
Yeah.
Lobster without butter doesn't work.
That's true. It really doesn't. But on the other hand, the good news is most of us can't afford to eat it every day.
Right.
So it becomes a treat.
A treat.
And something that
And you can do anything once in a while.
Exactly. Anything almost anything in moderation is perfectly acceptable. So if you have to think about two things that will be most likely to cut your risk of stroke, it's keeping your blood pressure under good control and keeping your cholesterol, triglycerides, and low density lipids down. Now, we usually give people statins, which is a medication that decreases cholesterol. And sometimes after a stroke, we give it to people even though they don't have a high cholesterol. Because the theory is that not only does the statin decrease the cholesterol, but it also acts as an anti-inflammatory agent. And it kind of smooths out that rough lining inside the vessel that's just had the stroke, and ideally prevents new clots from forming and a possibility of stroke. So you may get put on a statin medication after a heart attack or a stroke, even though you really don't have a high cholesterol.
As a preventive thing.
As a
Again,
preventive.
you have to go to the doctor and deal with this, because
Right.
these are all prescription medications.
Exactly. And if you have a problem with it, talk to your healthcare provider instead of just saying, I'm not going to take it anymore. Because then you're right back in that high risk group, and you're
You're in trouble.
you're increasing your
Potentially.
chances.
Well, thank you very much.
Well, thank you very much.
And this is the end of our first session on this, and we'll be back.